Last year in the U.S., postpartum depression affected 1 in 10 women, according to the CDC. That is why it's so important to know the signs early on before it gets worse. And here to talk more about it is Dr. Sarah Berga from Kaleida Health. Sarah, thank you so much for joining us this morning.
Delighted to join you. Thank you for an important topic.
Of course. So start off by talking about how does postpartum depression develop in mothers?
So it's mostly postpartum, but it's not always. And it can be the cardinal signs of depression, which include feeling low or depressed, not liking normal things, loss of appetite. And if it's really severe, then can progress to concern about oneself, harming the baby, harming oneself, and just overall what we would say fatigue, mental fatigue in general. And so it's highly variable.
You mentioned fatigue, loss of appetite, but what are some of the other symptoms people should look out for?
Well, I think then one that we worry the most about is if there is a tendency to suicide, or a concern for harming the baby, or just inability to care for either oneself or the baby.
And does this have any effect on the newborn?
Well, definitely. And so bonding is impaired. And that's one of the reasons we like to get involved earlier rather than later, because, when the baby gets neglected because mom is too tired or too uninvolved or is too distracted to care for the baby, sometimes other things start to develop, including failure to thrive in the infant.
And Sarah, when would you say it would be time to seek professional help?
So our goal actually is universal screening of all postpartum moms at their 6-week postpartum visit. And because not every mom makes it to that visit, it's somewhat difficult if they don't, because we like to do what's called the Edinburgh postpartum depression scale at that visit and ask moms, how are they doing? The pediatrician can also do this when they see mom, if their mom is bringing the baby in for a post-birth checkup. But we sometimes now like to talk about what we call the 4th trimester. That sounds funny because trimesters come in 3. But the months after a baby is born are really a big adjustment time, even if you've had a baby before. And so we now would like to focus more on that. And there is an extension now, as you may know, of maternity care to encompass the postpartum period so that we can do a better job.
All right. Well, Sarah, thank you so much for joining us this morning to talk about this. And
Thank you.
Of course. And still to come, meteorologist Mike Syka will share details on Buffalo's most accurate forecast when we come back.